Good morning. So, I want to come back and yeah, I had recorded my whole I had, recorded my doctor's appointment the other day. Well, I didn't record the appointment because as y'all know, I have trouble trying to record the screen. But anyway, so I did have my follow-up ultrasound from last week. So, last week I was measuring well, we didn't know. I'll put it like this. We only saw the gestational sac and the yolk sac. And I remember seeing something on the screen about 5 weeks and 2 days, but I had only put myself at, I think, 4 weeks and 6 days or something like that because I wanted to do the minimum, but at the same time, based on my calendar, that was pretty much the best thing that I could come up with because at this point I'm still confused as to when, how my levels were high. Came back on Tuesday, the 31st, and I went back to my endocrinologist. So we got in, and the male doctor did it this time. So he measured immediately saw the gestational sac. It measured at 6 weeks and 5 days. We did see the fetal pulse and a heartbeat. The fetal pulse measured at 6 weeks and 4 days. Heart rate was 108. Now, I'm still at this point. I'm like, you know, I was only putting myself at 5 weeks and 5 days, and then I had another calculation from what I saw on the scan the week before. That could have been I could have been at 6 weeks and 2 days. So he put me at 6 weeks and 4 days because that's what baby measured. Now, typically in all three of my pregnancies, in the beginning, I've measured at least 3 days to a week behind. So at this point, and I'm not saying I'm measuring behind this time, but I've always measured. But it still makes me wonder, like exactly, because on the screen at the end with the report, it had 6 weeks, 5 days to 7 weeks, 1 day. And like I said, the baby was measuring 6 weeks and 4 days, which is still like almost basically a week ahead of what I thought I was, and a few days ahead of what even a few days of what I measured last week. So it's like baby jumped up, which I know, things can differentiate, but and the gestational sac really doesn't, mean anything as long as it isn't shrinking and it's growing. So the only thing I had to compare was the gestational sac with this week and last week. So anyway, that was on the 31st. So I did. He asked me if I wanted to come back, and I told him, well, I have an appointment with my OB tomorrow, which was the first, which was yesterday. He was like, okay, well, I said, well, that works out. This probably works out perfect, so I don't have to come back. So he graduated me, so I got my blue folder, my certificate, and my paperwork and things like that I need to turn in after delivery. And then he did see the cyst, and he said, yes, probably just the corpus luteum. So he said it wasn't that big, and I was like, okay, good. So I think I'm okay with that, but I still have like sharp pains on both sides. Last night I had a good pain, and it almost threw me into, because it's like it started radiating, and it almost threw me into like an anxiety attack. So I had to jump up out the bed, and I'm like, okay, here we go again. I'm hoping this, not going to turn into anything. But anyway, so I went to see my OB. We're supposed to be doing a scan. I'm sorry for the noise. He do this every time, and it's so annoying. I was supposed to go for a scan and then see the doctor. So when I got there and got into the room to do the scan, she was like, how far along are you? And my big mouth, I was like, well, he put me at 6 weeks and 4 days yesterday, but we're still up in the air about it because I don't like. he put my cycle to start at April 15th, but I wasn't bleeding on April 15th. I didn't start lightly spotting until April the 18th, and I had like a good bit of spot on like the a few days later, so maybe like the 21st or something like that. And then there was just that one time, and then it went back to light spotting. So I didn't like April 15th couldn't be. The only thing I could think of was the fact that that might have been a true period that started April 18th or 19th, but then I ovulated super early. So like I said, I this none of this has ever happened to me. Especially with the spotting that long. I've had spotting before, previously with the diet change, but I don't know when I ovulated. I kept logging my symptoms and things like that, the ones that that were out of the ordinary. This make my cheek look like it's, but it was just, I'm like, well. So I did tell her. So I said, well, he measured me at 6 weeks and 4 days yesterday. She was like, okay, so you probably had a scan yesterday. And I'm thinking like, dang, I shouldn't say that. I was like, yeah. She was like, well, let me go and see if Dr. Moses wants to do one. So she left out, took a minute to come back. And at this point, I'm like, well, shoot, we could have went ahead and did the scan by now. Um, and so eventually she comes back and was saying that she was still waiting on a doctor. And then she left back and came back and said that, well, the reason why they had to check is because the insurance has been cracking down on how many ultrasounds they do in a certain amount of time. And um, it was something new that they had just started like last week. And I'm like, the insurance is just not going to let us be great. I said, well, they're going to stop us from doing everything eventually. I'm like, we paying for it. She was like, I know. And she was telling me a few other things that was going on with the insurance companies and things like that. I'm like, but this is our money, we paying for this. And I said, um, I had said something else, but I don't remember. But so we went out and went to the back to talk to Christy. She was like, well, you might do, I heard her say something about blood work, so you might do that today, but you might not. And I'm thinking to myself, I'm like, please don't let me have come way up here for nothing. Like, gas is expensive, and I already had Samaj, and he was all over the freaking place, and just so at this point I'm really just frustrated because I would really want the scan because I wanted like a second opinion or a confirmation on my dates. Um so when the nurse came in to, update me and things like that, I said, well, I was hoping to get a scan today because although he told me one thing yesterday, I wanted you guys to just confirm or, just get it on your own records of where I am and things like that. So, um, but she was just like, okay, I'm just putting everything in the system. So we weren't able to do that. So then the doctor came in. Well, no, she was saying, I'm going to give you a folder, and when Dr. Moses comes in, you're just going to go over the paperwork. And I'm like, so we're not going to do anything today? She was like, no. And I'm just like, I'm wasting my time, my energy. My child is working a nerve. Sorry to say this, but yes, yesterday I was frustrated, angry because I wasted my time. And the insurance companies are really, really, really getting annoying here. They've been just changing everything. So anyway, and I was kind of okay with it, but at the same time, I'm like I said, I wasted my gas getting there and being annoyed with my son running all over the place and just doing too much. So anyway, the doctor came in. We went over the everything. So she did tell me that we weren't gonna do McKenna because there was some things going on with them. They were withdrawing McKenna from the market. Obviously, I read yesterday, but I forgot what it said. And let me see if I can pull it up. If I still have it pulled up, I don't think so. So I think the issue was that they didn't pass the clinical trial or something like that to that proves it's effective. So In so many words, I think that's what it was. So something that they didn't pass um, to prove its effectiveness. So in the long run, I think they were saying that it might impose a greater risk taking it than not taking it. So she said we weren't going to do that this time. She asked me how I felt about it, but I was like, I'm okay with it, but I've done it all with my last two pregnancies. I was like, well, we still really don't know what happened with the first one. I said, and then with my irritable uterus, I have contractions throughout my whole pregnancy, pretty much, especially starting from like mid to late second trimester. That's when they really just start up, and I have them from then to the end, like basically every day. So I told her that, and so I'm like, but we don't have the proof that that's what was working. I know with Christiana, I stopped taking it early, and then that's when I went into labor early, with her, with Samaj. Get you some water. With Samaj, I stopped taking it around, I think, 29 weeks, 26, at my late 20s weeks. And because I started having allergic reactions, like my arm would bruise up and itch really bad. So I stopped taking it, and she was like, it's probably good that you didn't continue it. So I'm thinking to myself, like, yeah, you're right, because it really just came out of nowhere. That was that yesterday. I just came home, well, ran my few errands that I had to run, um, and came home. So yesterday was a very annoying day. A very, and I'm speaking from my hormones, um, and a little bit of myself, because I mean, like I said, who wants to? And I had to end up stopping to get gas yesterday. I don't like stopping to get gas, but um, yesterday was very annoying, irritating, frustrating, and just overall pointless. So, and I'm pretty sure I'm gonna get charged for that. Like, I feel like I shouldn't, because, like, y'all should have been keeping up with me. You know what I'm saying? And I don't want to get into it. But anyway, so then I called yesterday and I thought about it. I'm like, well, since they changing all this stuff, I'm like, let me call and ask if they're gonna still accept Medicaid for pregnant women. Called yesterday, left a voicemail, and she just called me back this morning, which is June the 2nd. So this is within 3 days. 31st, 1st, and 2nd. So she called me back this morning a while ago and said no. Now I haven't applied for it, and honestly, I might not get approved for it, but I just wanted to be sure of everything before I wasted my time with a lot of stuff. So she was saying if I did want to use Medicaid, I would have to find a provider that accepts it. So I was already on the fence. So y'all know I wanted to start recording my appointments. Went into the OB's office, and I thought I remembered we couldn't record, but I wasn't sure because I haven't been in there in years. So of course they had the little tape on the note on the TV screen that says no recording with their cellular devices. Now I can get away with my iPad because it's not cellular now, but I ain't finna get into all that. And even that, it made me want to. It's like I'm not getting the same vibe that I was getting from, back then. Now my doctor, of course, yes, she does her research. Okay, she does her research and everything, and I'm grateful that she stays on top of that, because any other doctor might have just let me go ahead with the McKenna and not said anything. But my doctor is okay. She's perfect. She even told me with my history, we might have to go to more frequent ultrasounds, but right now we're gonna stick with every 4 weeks. Well, every 4 weeks for visits. I honestly don't know how often they typically get ultrasounds, because I'm used to getting them like every 2 weeks, from start to the end, to every week or every few days. But anyway, but that really just made me like, I don't feel like finding another doctor. I don't. But there's some, like, I'm just not content anymore. All right, y'all. So yeah, like I was saying, yeah, I really don't feel like finding another doctor, but I want to be able to do what I want to do. You know what I'm saying? And y'all know me. I'm the type. I'm going. If I'm not content, I'm gonna speak up. But it's like I love my doctor. It's just the the whole setting in general. Everything is just changing. And if I do get approved for Medicaid, I'm gonna want to change because why spend the unnecessary money? You know what I'm saying? Normally, it's been about $700 to $800 to for like, because you know they do the package. They package everything together, and then you have to pay it before your 6 month. Normally, my bill runs about $700 to $800, between $700 to $800. But since COVID, I'm pretty sure it's gone up. So maybe I'm gonna send them a message and see about if they can go ahead and get me like that price range together, and then and then we will go from there, and I will decide whether I'm going to stay or find someone else. I think in the meantime I'm going to be looking for someone else, and and see. But yeah, so I didn't want to make this video too long, and I did pretty good. I just decided to record everything over just to get it out. So my next appointment with my current OB is not until June the 29th in 4 weeks. So today I am 6 weeks and 6 days. Tomorrow, which is Friday, I will be 7 weeks. So my weeks will turn over on Fridays until we see otherwise. Okay. So yeah. So I'm still doing the heparin. I'm kind of getting tired of it, but I think I just got to get in a space where I can settle, because I haven't been really just settled with. I don't know anything. Well, I don't know much. I'm trying to make sure my dates are accurate, because so I can know what baby is supposed to be like at what given point, and also just I need to know. So my due date, last week my due date was moved to January 23rd, 22nd, and then the other day they moved it to January 20th. So, but my OB put me back at January 23rd based off my period starting April 18th, which puts me measuring ahead and not behind like I usually. So, like I said, I know this pregnancy will be all different because this is out of the ordinary. It's natural. Like, it's a miracle, and I'm very, very thankful. I'm very, very grateful, and I'm really excited. I might not seem like it, but I'm really, really excited. I'm just trying to keep up with my videos and keep them up to date and in real time. So I'm just trying to get my videos out. And once I go, because we're geared to go on vacation, so I'm dealing with that too. Trying to get packed, get everyone's t-shirts done. But anyway, enough of that rambling. I will see. Hopefully, my next video, I'm gonna go over symptoms, and which I'll probably record that later on today or tomorrow, and then just put it out tomorrow or sometime. And yeah, go over symptoms, and then I'll do a video of me telling my family. A lot of them know, but some of them that were going on the trip with us don't know, so that probably will come later on. Maybe next week sometime. I'll try to upload while I'm in Florida. So and I also would do some footage for the vacation. So I will see you guys in the next video. Please be sure to like, comment, and subscribe. Keep up with us on this journey. And also today's our anniversary, so I will be uploading maybe our shorts of our video shoot and celebration and things like that. So He finna get wild. I'm gonna see y'all guys. We finna go eat. So I will see you guys in the next
Mommy,
video.
we don't.